Good morning, Lambton County Council, members of the public, as well as the media. Welcome to the October meeting. I'd ask Ms. Leger to take the roll call, please.
Yes, thank you, Warden Marriott. Councillor Agar. Councillor Atkinson. Councillor Bushi. Councillor Bradley. Councillor Broad. Councillor Case. Councillor Cook. Councillor Dennis. Councillor Ferguson. Councillor Hand. Councillor Loosley.
Present.
Councillor McRoberts. Present. Councillor Miller.
Present.
Councillor Sageman.
Present.
Councillor Veen.
Present.
Deputy Warden White.
Present.
And Warden Marriott.
Present. Thank you.
Quorum.
We acknowledge that this land on which we are gathered today is part of the ancestral land of the Chippewa, Odawa, and Potawatomi peoples, referred to collectively as the Anishinabeg. It is through the connection of the Anishinabeg with the spirit of the land, water, and air that we recognize their unique cultures, traditions, and values. Together as treaty people, we have a shared responsibility to act with respect for the environment that sustains all life, protecting the future for those generations to come. Item number 3, I'd ask any member of council to declare pecuniary interest now or where it may arise. Councillor Loosley, please.
Thank you, Warden Marriott. I do have one on 9A, the EMS presentation, and that's due to the fact that my son works part-time for the EMS, and I've given the necessary paperwork to the clerk.
Okay, thank you. Are there any others? Seeing none, I'd look for a motion to go in camera for the reasons noted in the agenda. Councillor Hand, seconded by Councillor Loosley, all in favor. That's carried. We'll be in committee room 3 to my left. Welcome back to the open session. Please join me for a moment of silent reflection. Thank you. I'd ask Ms. Leger to rise and report motions of in camera, please.
Yes, thank you, Warden Marriott. I can report that Lambton County Council met in camera this morning for approximately 10 minutes to address a few matters. First being to review and approve the Lambton County Council closed session minutes dated September 4th, 2024. Secondly, to receive advice subject to solicitor-client privilege and provide direction with respect to the City of Sarnia, and if the City of Sarnia moves forward with an application for an injunction, the county will support the city in providing affidavit evidence and any other information reasonably required. Lastly, Council review and approve the Committee of the Whole closed session minutes from September 18th, 2024. That included receiving a report and providing directions with respect to bargaining negotiations between the county and ONA Local 19.
Thank you, Ms. Leger. Item number 8, delegations. I'd look for a motion to allow today's delegation presenter to come forward. Councillor Case, and seconded by Councillor Loosley. All in favor? That's carried. Thank you. Our delegation, Kate Burns-Gallagher, Executive Director, Western Ontario Wardens Caucus, known as WOWC, will be presenting to County Council regarding Western Ontario Wardens Caucus strategic priorities for 2024-2025, and including accomplishments over the past year. Welcome, Kate.
Great. Thank you. Good morning. Thank you, Warren. Through you to County Council. It's a pleasure to be here today. Thank you. As the Warden mentioned, my name is Kate Burns-Gallagher, and I'm the Executive Director of the Western Ontario Wardens Caucus, and I'm here to present our priorities that we've been working on for the past year, as well as some accomplishments that we've had over the past 18 months. So we'll get that going here. Let's see. There we go. So just a quick overview of who the Western Ontario Wardens Caucus is, or WOWC as we affectionately call ourselves. We are the 15 upper and single tier municipalities west of the GTA, 300 communities, 117 municipalities strong, 1.6 million residents and growing, and 90% rural. And that's really the glue that binds our region together, is our small and rural communities. And that's where our advocacy really comes from, is really advocating on behalf of our small and rural communities. And the purpose of the organization is to speak with one voice. We've had great success over the past several years in speaking together as a collective of the 15 counties working together. When we look at our regional data, look at our regional research, and then speak with that one voice with the 15 wardens together, we can get a lot accomplished. And as I'll touch base later on the presentation, the things that we can do together is quite incredible. And how do we do that? We do that with an incredible team. We do that with our caucus, where you're represented fabulously by Warden Marriott, our CAOs with CAO TIFO, and then our staff with our executive director, manager of government relations, and an admin coordinator. And then we have our economic development committee, where the warden sits. And then we have introduced in the last 18 months our subject matter expert teams. And these are the staff from the 15 counties that are in relation to our priorities. So for planning, we have Corrine, who sits on our planning for social services. We have Valerie sitting on that committee, communications, Lisa, and economic development from Sarnia Lambton ECDev. We have Carrie and Matthew sitting there. And just a special mention too, we are incredibly appreciative of the support we receive from Lambton County. So many thanks to Melissa, Leah, Carly, and Janessa for all the support that they give us. And our advocacy, as I mentioned, is the piece to the puzzle of what we do. And we do that through meetings with ministers and senior government officials, partnerships with other regional organizations, and we do a lot of writing and research, whether it's letters, financial analysis, ERO submissions, and shortly a pre-budget submission for this fall. And we also partner with other organizations, from the Association of Municipalities of Ontario to Roma, Eastern Wardens, Eastern Mayors, and Ontario Big City Mayors. Now, without further ado, and I'm sure of no big surprise, our first priority is housing. And this year we've been advocating incredibly strongly on two key asks. The first being requesting that the last two pieces of development charges that were not included in Bill 185 be reinstated. And that's the cost of land and the cost of housing services. Those two pieces alone will be equivalent to $10 billion over the course of the next 4 years to municipalities. Incredible amount of money for municipalities that we can use to support growth development. So we're asking for those last two pieces to be included back in to DC eligible costs. The second is we're asking for equity for our small and rural communities regarding housing infrastructure funding. When we look at the Building Faster Fund, when we look at Housing Accelerator funding at the federal level as well, we need to make sure our rural and small communities also have access to those funding dollars. And in many cases, we have not had the access. Our second priority, and these priorities do not operate in silos. You can't have housing without infrastructure, and you need the infrastructure to support the housing. We are advocating for infrastructure for our region. And the key here is that our region in the last 18 months has been home to $40 billion worth of investments between Stellantis and Essex County, Volkswagen, St. Thomas and Elgin, Honda and Simcoe, and Bruce C. and Bruce Power. That's just the major announcements. Then there's all the support announcements that go with that. And that's up to 30,000 jobs just in Western Ontario in the last 18 months that have been announced. That's a lot of housing, that's a lot of roads, that's a lot of water and wastewater. And we need to make sure that the province has us at the table for all of those infrastructure discussions. So we met with Minister Storm at AMO to raise the concerns that we're having for the infrastructure development in the region. Third, not surprisingly, workforce. Once again, we need the workforce to build the infrastructure and the housing, but we also need the workforce to support the people in our communities. So we're really working quite closely with the Ministry of Labor, Immigration, Training, Skills Development to talk about the healthcare and social services sector, particularly when it comes to early childhood education and healthcare for our long-term care homes. So making sure that there are RPNs as well as PSWs for our long-term care homes, because that was something we've heard across the board that are issues for our member counties. And last but not least is mental health addictions and homelessness. We've been working quite closely with Minister Tabolo's office as well as the Solicitor General's office in asking for dedicated rural funding for the homelessness prevention program, not taking away funding from our urban counterparts, but asking for dedicated rural funding, because we know that homelessness looks different in our rural communities, as well as asking for permanent funding for the mobile crisis response teams as well. And we are pleased at AMO, we partnered with the Eastern Ontario Wardens Caucus and the Eastern Mayors Caucus to support the Ontario Big City Mayors in the Solve the Crisis campaign. And this Friday, the chair of the Ontario Big City Mayors, Mayor Marianne Mee Ward, will be joining the caucus at our caucus meeting to discuss next steps and how the Western Ontario Wardens Caucus can support the Solve the Crisis campaign. And as always, we continue to support SWIFT and the broadband infrastructure build out in the region. On September 16th, I'm sure some of you saw the announcement where SWIFT received SWIFT 2.0 funding, or $34 million to get to the hard to reach locations in our region. And there'll be more to come on the details of that investment from the province shortly. As I mentioned, Warden Marriott sits on our Economic Development Committee, and this committee really fuels the advocacy work for the organization. Right now, the Economic Development Committee is looking particularly at transit, as well as the blue box transition, and ensuring that our industrial, commercial, and institutional facilities can get included on the producer's pickup list for Blue Box transition. So those are two of the, and transit as well, as I mentioned. So those are the two hot topics right now with the Economic Development Committee. And we're very grateful for CAO Tifo, who sits on our conference committee. We are bringing back the Ontario West Municipal Conference after a 6-year hiatus, and it will be on October 25th in Chatham, Kent at the John Bradley Centre. A fantastic day. If you have not already registered, you still can. We have many ministers attending. Paul Wells is our keynote speaker, some incredible exhibitors as well, and a wonderful day, all wrapped around our strategic priorities with breakout sessions and learning lessons. So we look forward to seeing many of you there. And to wrap things up, looking at our accomplishments here over the past 18 months, we've done a lot working together, as I say, with the power of those 15 wardens. About 18 months ago, or maybe even 2 years ago actually, some federal MPs approached us when they were looking at the federal riding redistribution map and mentioned that we were looking at losing a rural seat in Western Ontario. So we worked with our federal counterparts in advocacy to the federal riding redistribution program, and we were able to secure our federal riding seat count for rural Western Ontario, which was a huge win. In May of 2023, we also did some advocacy when the province announced that there was the possibility of 3 severance lots for every farm parcel in Western Ontario. That would have taken out of production about 750,000 acres of farmland in Western Ontario with one piece of policy. So we quickly advocated to have that reversed, and we were thankful that it was. We've successfully had the leave to construct threshold, so that is the for natural gas projects, the threshold for going to the Ontario Energy Board increased from $2 million to $10 million. We've secured community response pilot project funding for the region, particularly here in Lambton County. We were pleased to do that. And we've received attendance invitations for the Provincial Housing Forum. And as I mentioned, also bringing back the Western Ontario Municipal Conference. So some great accomplishments over the past 18 months when we work together. So it's a pleasure to be here today to provide a little update on the Western Ontario Wardens Caucus, and if there's any questions, I'm pleased to answer them. Thank you so much for the time, Warden.
Thank you very much, Kate. And as you said, we work well together, and the power that WOWC has with the provincial government is very noticeable when we go to conferences. So, and thanks for all you do. Are there any questions for Kate? Councillor Atkinson.
Thank you, Warden. Not really a question, just a comment. I want to first of all thank you, Ms. Gallagher, for your comprehensive report. I do want to commend you and your group for continuing to work for the advocacy of our municipalities, especially with SWIFT. I have an area in my municipality that is begging for internet service, and it's really hurting. So if you can continue to work for that on our behalf, we'd certainly appreciate that very much.
Thank you, Councillor Atkinson. Any other questions or comments? Looks like they're going to let you off easy today, Kate. Thank you again for your driving down today. Item number 9, presentations. We have 2. The first one is Stephen Turner, manager of Lambton EMS. Will be speaking to provide details regarding updates to Lambton EMS Deployment Plan. Welcome, Mr. Turner.
Good morning, Warden Marriott and members of County Council. I'm Stephen Turner. I'm the manager of Lambton's Emergency Medical Services. So today I'm going to provide you with an overview of the proposed revisions to the EMS Master Plan. As you may recall, the EMS Master Plan brought to you in last October outlined 16 recommendations to help improve the efficacy and efficiency of ambulance service for the next 5 years. Recommendation number 11 identified a need to update the services deployment plan. This plan outlines how ambulances are positioned and assigned to 911 calls for service. The goals in updating the deployment plan included minimizing response times to life-threatening emergencies, ensuring an ambulance is available when and where it's needed, and reducing the impacts on our crew and our fleet. When I spoke to you last October, I identified that our service wanted to ensure that we could improve our response times to life-threatening emergencies while making better use of our current resources. We had heard from council, the public, and our paramedics that we had room for improvement. The deployment plan is an important component of these improvements. The deployment plan is a nuanced operations document. It prescribes which stations are prioritized for coverage, which ambulance is chosen to respond to a call, and when certain calls may need to be held in the queue to allow for responses to higher priority calls. It also sets out when meal breaks are assigned for each crew and how assignments are handled around shift changes. The key updates to the deployment plan are shown here, and I'll go into more detail around each of these shortly. While Lambton EMS continues to meet the council-approved response time targets, response times have been slowing in most areas of the county. During our work for the EMS master plan, staff provided a drill down of response time trends in Lambton's municipalities and identified some areas of concern, including Brook-Alvinston, Don Euphemia, and Warwick. Our paramedics had also noticed that their work days were becoming busier, and a large proportion of their work involved frequent relocations to other areas of the county to provide Code 8 or standby coverage. Analysis of that workload showed significant discrepancy between stations and also identified 4 stations that will exceed the recommended unit hour utilization within the next 5 years. In the face of this workload increase, we've seen increased staff absenteeism and an increasing frequency of times when the service has been unable to staff a specific ambulance. When an ambulance is sent on a response to a call, often another ambulance is moved from one area to another to provide coverage for that unguarded zone. These are called Code 8s or standbys and are an important component of maintaining balanced coverage across the county. These graphs demonstrate how standbys are assigned, where they are sent, and whether the standby resulted in the crew being sent on a subsequent 911 call. On the left-hand side, each of Lambton's stations, and the size of that bar shows proportionately how many standbys are sent from that station. In the middle of the chart, stations ranked by how many standbys are sent to that station. And on the right side is the number of times an ambulance was sent from its standby location to a 911 call, and in which area that occurred. As you can see from the chart, Brigden, Brightsgrove, and Watford provide most of the standbys, while Sarnia, Petrolia, and Corunna do most of the are the most frequent destinations for those standbys. You may also notice that most of the time, the ambulance sent on standby is not subsequently sent on a 911 call, but rather returns back to its original station unassigned. The updated deployment plan aims to make better and more efficient use of standbys, which will reduce unnecessary fleet movement, fuel usage, and crew fatigue, while aiming to ensure there is better coverage of the south and eastern ends of the county, where we've seen increasing and prolonged response times. This highlights the movement specifically of Brigden Station in particular, where the low efficacy of sending the station on standbys in Corunna. When Corunna crew is out on a call, the standby vehicle in that area is rarely sent on a subsequent call, and Corunna's response area can actually safely be covered by ambulances positioned in Brigden and Sarnia, allowing for better coverage for the south end of Lambton County. I've included these slides to demonstrate the level of analysis that went into updating the standby policies. Our goal is to improve response times county-wide, but especially in those areas where response times are high or have been increasing at a faster rate. To that end, we're developing 3 zones with an aim to maintain the highest level of coverage in these areas with the resources available. Sarnia, Forest, and Petrolia are the population centers in these zones with the highest number of calls and are also relatively centrally located within the zones. Corunna and Brightsgrove will be responsible for providing coverage to Sarnia when the ambulances in Sarnia are on calls. Thetford and Grand Bend will support Forest, and Watford and Brigden will support Petrolia. Well, most importantly, our goal with changes to the standby policy is to improve emergency response coverage throughout the county. These changes will also help to markedly reduce paramedic workload and fatigue. We'll have multiple fleet impacts, including reducing wear and tear through less driving, saving money in fuel consumption and maintenance, and decreasing our fleet greenhouse gas emissions by 60 tons per year. Interfacility transfers are ambulance calls that originate from a facility rather than from the community. Lambton EMS completes about 1,000 interfacility trips annually, ranging in urgency from high to low. These calls are important to our hospital partners in order to help leverage the services that may not be available locally and to assist with managing their patient loads. However, there's an opportunity to better ensure these calls are serviced when we have sufficient resources to also serve 911 calls in the community. There will be times when we may need to delay a non-emergent interfacility transfer for up to 6 hours when we have 3 or fewer ambulances in the county or when the road conditions are poor. However, these are rare occurrences and supervisors will work with hospital staff to identify any patients who may need to be transferred out sooner. Out-of-county transfers may take an ambulance out of our service area for well over 3 hours, and so we've also limited these calls to ensure only 1 ambulance is sent out of county at a time. And in order to better balance workload between stations, more of these interfacility transfers will be done by crews not based out of Sarnia. We've met with senior leadership at Bluewater Hospital as well to review these changes and to confirm that they do not have any major concerns. Without changes to our deployment or our staffing, the number of times that no ambulance is available when somebody calls 911 is anticipated to increase 4-fold over the next 5 years. Our goal is to hold the current level steady with the strategies detailed in the master plan and this updated deployment plan. 911 calls are triaged by the Ambulance Communications Center in Wallaceburg. Emergent calls are typically involve potential threat to life or limb, such as chest pain, unconsciousness, shortness of breath, or motor vehicle collisions. Non-emergent calls may include complaints such as minor orthopedic injuries or general illness. In the circumstances where we have 3 or fewer ambulances available in the county, the updated deployment plan will allow for these non-emergent call types to be deferred for up to 30 minutes before being assigned. As soon as more than 3 ambulances are available or 30 minutes has passed, the call will be assigned and an ambulance will be sent. A non-emergent call may also be held temporarily or assigned to a more distant ambulance to allow for a shift change to occur or for that vehicle to be stocked and ready to respond. We recognize that this may result from concerns from the public when a response to a non-emergent call is delayed, but it's important for us to be able to manage call demand in times when our system is pressured and to ensure that resources are available for those emergent calls, which may require a more immediate response. We'll monitor these situations closely and review circumstances where responses are delayed abnormally. In keeping with the master plan's first recommendation, to maintain priority on staff well-being, we've developed a dangerous weather policy. On the rare occasions when the road conditions have deteriorated to the point that they are not safely passable, we will pause operations in that area until conditions have improved sufficiently or until we're able to get support in getting to the call, such as using a snowplow for an escort. Our crews can't help others if they can't get there safely, and there are limits to the environments in which we can operate. Activating an all-stop will be on the authority of the manager and will be limited in time and location when the conditions are severe. It will be rescinded as quickly as possible. And we will also work to provide public messaging when these conditions are likely to occur. Advanced life support paramedics are paramedics who have completed an additional year of training to specialize in advanced care for emergency conditions such as cardiac arrests, seizures, and airway compromise. Lambton EMS employs a number of advanced life support paramedics, but their deployment to date has not included any special criteria to send them to calls when they might have a greater impact on patient outcomes. So to this end, the deployment policy will now have an ALS medic sent to calls involving these conditions shown here when they're available and close enough to reach the scene before the initial crew departs for the hospital. The updates to the deployment plan will help improve the availability of ambulances for emergencies, provide better response coverage for those areas in the county which have had longer response times, reduce wear and tear on our fleet, improve safety and workload for our staff, and will help get the right resources to the patients at the right time. During periods of high demand, some non-emergent calls may experience longer wait times for an ambulance, but we expect these to be limited and will continue to monitor the impacts to make changes to our plan as needed. The deployment plan is meant to be a living document and should be amended in response to changes in our operating environment so that we can provide the best service possible with the resources we have. Thank you.
Thank you for that presentation. Any questions or comments from Councillor Bradley, please.
Just a curiosity question. What are people told when they are on the low priority list and they are in stress? What are they told? What is the common message that goes back to them to say, we will get to you, but we cannot get to you because of other more pressing needs?
Mr. Turner, please.
Thank you, through you, Warden. The Central Ambulance Communications Center would communicate back to the callers, and in some cases they would identify if there was anticipated to be a delayed response. In the circumstances right now, as it currently goes, an ambulance is dispatched every time somebody calls 911 and immediately. So this is a change that we've been working with our partners in the provincial government to operate the Central Ambulance Communications Center.
I'm guessing based on police experience, when a call is delayed and backed up, the response back from the public is not usually particularly favorable. And are you fully prepared for that? Because you know where the complaints are going to come to.
Mr. Turner, please.
Through you, Warden. Thank you for the question. My intent in providing this presentation today was to prepare councillors with this information, because we do know and recognize that either our service or yourselves will be receiving those complaints from the public should there be delays. We anticipate, as mentioned, this is limited in time to those circumstances when we only have 3 ambulances left in the county. Right now at peak, we operate with 12. And so these are rarer occurrences, but they are anticipated to happen on occasion, and we'd like to have you prepared so that you understand the rationale and that we're focused on life-threatening emergencies.
For that.
Deputy Warden White has a question.
Thank you, Ward Marriott. On that same note, do you have any data to indicate how often those circumstances do occur, where you would have 3 or fewer ambulances available and you would now be holding non-priority calls up to 30 minutes?
Mr. Turner, please.
That's through you, Warden. Thank you, Councillor White. Yes, we do. As I identified in this circumstance, these are code blacks, and this is when we have no ambulances. These are circumstances where we had, in 2023, 50 occurrences where we had no ambulances to send. The frequency where we have 3 or fewer right now, I don't have the exact number. I can get that back to you, and we'll provide that once I get back to my computer and can pull it up for you. I'd imagine it's probably in about 4 or 5-fold to what we're in code black situations.
Any other? Councillor Broad, please.
Thanks, Warden Marriott. Mr. Turner, I want to thank you for this deployment plan. Anything that you can do to improve our response times is definitely a bonus to us. I hear the concern about the 9 non-life-threatening events, but we have life-threatening events that we are very delayed on. So I want to thank you for the deployment plan. Look forward to getting it in play, and then let's see the results from it. But thank you very much to you and your staff on preparing it. Thank you.
Thank you. Anything else before we let Mr. Turner go? Seeing none, thank you again. Our second presentation is Sarah Churchill, Community Engagement Specialist, Social Services Division, will be presenting regarding part of the solution campaign.
Good morning, Warden Marriott and members of County Council. Thank you for having me today. As the Warden said, my name is Sarah Churchill, and I'm a Community Engagement Specialist for the Homelessness Prevention and Social Planning Department. I'm here to speak to you today about a new initiative coming out of social services called the Be Part of the Solution campaign. The intention with this campaign is to provide communications on homelessness and housing issues that are accessible to community members. And some of the context for this is discussions that happened at the Stronger Together Summit in 2023. So when cross-sectoral community leaders, people with lived experience of homelessness, and members of council such as yourselves came together to discuss these issues, it was identified that there is a need for public education around homelessness prevention and housing, and a communicative campaign that could let community members know what's going on, what services are available, and what interventions are being explored long-term. This has also arisen with the visible increase in absolute homelessness in Lambton County. So as we see more folks outside and more folks experiencing housing insecurity, we want to answer questions from the community and address narratives and misconceptions about homelessness. The messaging of this campaign will be communicated through 3 key areas. So the first of these is understanding homelessness, and the second and main component is being part of the solution. So every day we have folks asking, what's going on and how can I help? And there's a broad range of community support, local volunteers and networks who want to join in and be part of the solution. So this is meant to be an answer to those questions and a resource that people can use. And then the third section of this messaging is understanding Lambton County's approach. So answering questions on current services and breaking down various homelessness prevention approaches. To give a quick overview of this project plan and what to expect from the campaign in the coming months, August was engagement with members of the local social services network, members of the Lambton Drug and Alcohol Strategy, and we held an office hour with many service providers who collaborate on homelessness and housing solutions to get their feedback on preliminary materials and see where gaps are missing in what they are asked in their daily work. As well, we presented to and engaged with the county's A Better Tomorrow Committee, which is a collective of individuals with lived experience of homelessness or who have been homeless in the past. So integrating the feedback from this engagement process, we brought a committee report to Committee of the Whole in September, providing an update on the formed campaign. Now we're at October and we're hoping to get this information out there through various avenues. So this week we've started social media engagement, posting online and asking our partner agencies to reshare content, and this will continue through much of November. In December, we will look at communications from the campaign that got high web traffic, things that partners said their community members found useful, and the resources that were most engaging and most accessible to folks will be implemented into communications going into 2025. On our Understanding Homelessness page, we have a few key sections. The first of these is a myth-busting poster series, and the goal with this is to address misconceptions about folks experiencing homelessness in a graphic way. These can be printed and downloaded by agencies and shared in their spaces. And we'll move into in November the blue posters you see, so talking about evidence-based services, interventions that work, and addressing any misconceptions or questions about those. This piece is root causes of homelessness. So highlighting how systemic factors and individual factors interact with each other and intersect to create complex experiences of homelessness. So we know things like relationship and family breakdown and gender-based violence and health issues can lead individuals to become unhoused, but also the compounding impact of the housing crisis, the cost of living crisis, and ongoing opioid crisis cannot be ignored when talking about the root causes of homelessness. And finally, we want to highlight urgency on this issue and provide information on the health costs of experiencing homelessness. So these individuals are dying at a rate 2 to 3 times higher than the average Canadian, and we're losing members of the community as early as 34 years old. And providing information on the health and wellness and mental health discrepancies and highlighting the community loss this leads to. We also want to highlight the cost side, so what downstream expenses and keeping people long-term in hospital beds, corrections facilities, and shelters can cost in comparison to interventions such as social and supportive housing. Being part of the solution is the cornerstone of this campaign. So you'll see when you go to the website and on your screen, we have 8 concise calls to action that community members can take. And when they click on one of these actions, they're taken to 1 or 2 links where they can immediately move forward in that area that they have chosen. So some of these are more accessible and low barriers, such as becoming informed and browsing the website, sharing information on social media or in your social circles. And then some of them are for community members who have more capacity or want to be more involved. So volunteering with local agencies, and we've provided a page that links to local agencies and ways you can volunteer with them. And as well, things for groups. So congregations or neighborhood associations who want to get involved in supportive housing or mobilizing their group to do more initiatives such as fundraising or partnerships. And the final piece on the website here is clarifying Lambton County's approach. So this will provide a brief overview of prevention, emergency, and long-term housing solutions, the 3 kind of core areas in our service approach. But the main thing to look out for here is the frequently asked questions and monthly data updates. So every month, a frequently asked question that the community has will be addressed, shared out on social media, and included on this website. And on the 15th of every month, data on homelessness will be updated and shared through this avenue as well. So the number of people who are unhoused, housing placements, and progress and local highlights. Here, I want to quickly highlight some work that is being done by a team who is on the ground with individuals experiencing homelessness every day, and they are leading local solutions. This is the Community Health Integrated Care Team. And before I show this video, I just want to say, on the day that the team was participating in this video and came to shared services, while we were outside, just for a few minutes out front, we had 4 community members, individuals, approach them, say hi. They knew their names, they knew their faces, and they came by, they got water, they got a snack, and they had a check-in with these workers. So the rapport and relationships they've managed to build in such a short time with this pilot program, it was really impressive to see. But I'll let them speak more to their work.
Understanding the reasons that people are homeless is probably the biggest thing for everybody. It's not a choice.
They're just at a struggling time. There's a lot of barriers right now, and we're trying to advocate again for them.
My main focus is healthcare, making sure that they are getting medications they need, or if they need wound care for wounds that they have, trying to keep them clean.
And support them wherever they need and provide those resources, or provide them with the resources that they may not know exist.
With them being homeless, it's hard for them to reach out for help. They're afraid of what people are going to say to them.
There's a lot of stigma. I'm hoping that working together we can kind of squash some of that stuff.
They don't want to be homeless, they want to be back living in normal housing with normal lives, but it's just difficult for them to get past those barriers.
These are a few of the other partners, and there are many who are providing emergency services and ongoing services every day while advocating for longer-term solutions. But in those videos, we have the outreach team, community health integrated care team, and Blue Water Health. So I'll end with the campaign information up here, our QR code, our website information. But we want this to be used by community members who are asking questions, who have concerns, and who want to help. And we can direct people here to help with addressing homelessness in ways big and small. So thank you for your time today, and I've included the campaign contact here as well. But yes, all open to any questions. Thanks very much.
Thank you for that presentation. Any questions or comments from council members? Councillor Bradley.
Thank you for the presentation. General comment is that the more information that could be provided about the struggles that are out there, it's for everyone's benefit. So I appreciate everything you're doing and the group too. So thanks for that.
Thanks for that. Anything else? Seeing none, thank you again, Ms. Churchill. Item number 10, minutes of open session council of September the 4th. I'll look for a motion to approve. Councillor Broad and Councillor Agar seconds. All in favor? That's carried. Item number 11, Board of Health. Dr. Duick, please. Item 11A, Board of Health correspondence to receive and file. I'd look for a motion to receive and file the one item. Councillor Case, seconded by Councillor Ferguson. Any questions? All in favor? Opposed, if any? That's carried. Item 11B, Board of Health information reports. Have two files here. I look for a motion to receive and file. Councillor Agar and Councillor Loosley, all in favor. That's carried. Is there any other business for Board of Health today? Deputy Warden White.
Thank you, Warden. Just a general comment. It does go back, or a question back to the item in regards to the heart hubs, the treatment, the change in the supports. Is there a general comment being shared from ministers of public health in regards to the change in providing the direction that the government is taking in reducing access to safe supply and sharps?
Dr. Duick, please.
Through you, Warden, I have not heard any statement from the Chief Medical Officers of Health across Canada on the change in Ontario's model through various ministries for heart hub models locally. And so we work with many community partners to try to reduce the harms related to the toxic drug crisis through those three different mechanisms. However, to your point, the policy decision made on the heart hub.
Deputy Warden.
Just to follow up then, yeah, thank you. Is there any early indication of what strategy might be employed then to continue the harm reduction model, given that the access to safe supply has been essentially cut off?
Dr. Duick, please.
Through you, Warden, the Ontario Public Health Standards are legislated through the Health Protection and Promotion Act. And so at the local level for public health units, we each are mandated as health units to provide needle exchange programs, which is a modality of harm reduction. And we continue to do this within our health unit, as do all other health units across Ontario. So we do follow the policy direction from our Ministry of Health for our mandate and the work that we do.
Councillor Dennis.
Thank you, Mayor, Warden Marriott. To the doctor, so just to be clear, we are not participating in safe supply, is that correct?
Dr. Duick, please.
Through you, Warden, health units do not provide safe supply, which is medication, hydromorphone, that is within the clinical realm and would be a regulation through the CPSO. It would be up to the individual practitioner and their patient, and they need to be following the standards through the CPSO.
Any other questions for Dr. Dewick? Seeing none, thank you again, Dr. Dewick, for here today. Move on to item number 12, correspondence. We have 2 items. We'll consider each one separately. The first one is a memorandum from Sean Court, Assistant Deputy Minister, Long-Term Care. A detailed summary of proposed amendments. Look for a motion to receive and file this. Councillor Cook moves. Councillor Hand seconds. All in favor? That's carried. The second one is a letter from Matthew Slotwinski, Chief Executive Officer of Sarnia-Lambton Economic Partnership. There is a recommendation there. How would you like to deal with that? Councillor Bradley.
The suggested direction.
Thank you. Seconded by Councillor Sageman. Any discussion? Councillor Dennis.
Thank you, Warden Marriott. I do have some concerns with this, especially in today's environment. With we just had a presentation by a young lady talking about the homeless, and you know, there's the best remedy to get people off their butts and make them productive members of society is a job. And there's a lot of people out there looking for work, and they can't find work. You know, there's a lot of people employed in this county trying to help people better themselves and get them off social assistance and get them back up on their making them productive members of society. I don't think this is the right. I think this is wrong, quite honestly. That they have to bring in foreign workers to when there's Canadian residents or Canadian citizens that can do the work. This is not right. This is happening in the United States also, and we have to think of our own. And you know, like you know, the young lady talked about various studies that have been done and how to determine homelessness. Well, you know, during the course of my life, I'd been broke many times, and there was never a study done about being broke. Being broke is when your inflows don't match your outflows, and you know, good. You don't need studies. It's just good common sense. You know, spend your money properly, and you won't go broke. And work hard and save your money. And there's just too much nonsense and not enough common sense when it comes to this sort of thing. So, like I say, I know some people have an agenda when it comes to this sort of thing, and it's time. It's about time that common sense starts to rear its head again, because the majority of Canadians don't agree with this sort of thing.
Thank you, Councillor Dennis. Councillor Cook, and then.
Mr. Warden, I guess someone who's worked well with the migrant community in our Lambton Shores area, I really do appreciate this coming forward, because I think migrant workers are kind of the backbone of what is helping our industry grow in some of these places. We can't get some of our local people to come in and do the jobs that are necessary. We do need our foreign workers to come in, and these are the people that are going to take these jobs and will do these jobs successfully. So I think I fully support this, and I appreciate that this is coming forward. Thank you.
Thank you. There was Councillor Hand.
Along with what Councillor Cook said, I know in the medical community we're struggling to find enough staff in nursing and doctors and in the nursing homes. And one of the avenues that they have been looking at is bringing in people that have the skill sets that can supplement and help us with that crisis. So I support it. Thank you.
Thank you. Any other comments? Councillor Bradley.
I would point out to you, and I agree with the 2 other mayors, what they said. This is a gap that we are not filling locally or nationally. I had the privilege on Sunday afternoon to be with 100 people who fled the Ukraine to come here, and walking around talking to them, every one of them had found gainful employment, places to live, and were supporting themselves and supporting the community and skills that we needed. So that's what this is about. All you have to do is look at the demographics in Lambton County. The birth rate simply isn't cutting it. It hasn't been for years. By strategically investing in people, and again, I point out as I close on, this is supported by business and labor. Chamber of Commerce, everyone on the Economic Partnership Board said, we need to do this if we want to have a prosperous future. So it's a good direction.
Councillor Dennis and then Councillor Ferguson.
When Councillor Bradley talks about the demographics of Lambton County and he uses a graph like this, that's probably over the last 30 years or so. And that has to do with the fact that Sarnia hasn't grown in the last 40 years. And all the young people, like Pied Piper, have left the community off for better and bigger things. So that's not so much a demographic thing. That's the way that how Sarnia has been run the last 30 or 40 years. And that's going to be changing very, very soon. So laugh all you want, it's true.
Yeah. Councillor Dennis, thank you.
Anyway.
Councillor Ferguson, please.
Can I just have to clarify what the recommendation is? Because here it says receive and file, but I'm wondering, is that what you really meant?
I'll look to Councillor Bradley. I don't believe that's what you move in the recommendation.
We're endorsing the proposal, just so they know that they do have the support of Lambton County.
I'll call the question. All in favor of the motion? Opposed, if any? That's carried. Moving on to item number 13, information reports. There's 2 reports, and again, we'll deal with these separately. The first one is regarding the homelessness prevention and affordable housing update. Councillor Miller moves, and Councillor Bean seconds. Any discussion? Councillor Bradley.
In this report, it references that letter I'd sent to County Council back in August, and perhaps I wasn't as specific as I should have been, but really what I was looking for, and there's some acknowledgement here that the county says they deal with the issue of families, which shows up quite a bit with feedback I received in the community, and then the other issues that relate to the court decisions about what shelters need to do. So if I need to move a motion today, I will do that. What I was really looking for is what would be the cost to do those upgrades in the shelter system itself, like other places are trying to do, versus the sort of the ad hoc putting people in hotels and some of the other things that were mentioned in that report. It's not a criticism, it's just, that's a number that we really need to know as we move forward on this homeless issue. Is that doable, Ms. Calasani, for the next meeting? Just whether it's the inn or River City is given a special assignment or whatever, just a rough number of what it would cost us to meet those needs if we move forward on an injunction.
Ms. Calasani, please.
Through you, Warden Marriott, to Councillor Bradley. We took a look at the existing shelter system and we spoke with the Inn of the Good Shepherd, and unfortunately they don't have space for couples right now at the existing lodge. So that's why we're looking for alternative solutions for couples. River City Vineyard only accepts individuals who are not using drugs or alcohol, and our experience shows that many of our couples are indeed using drugs and alcohol, so they would not qualify to go to River City Vineyard. So in the absence of that, we weren't able to do any costing. The overflow shelter is temporary, and there's not the space there to put up anything to accommodate couples. It's actually only for males. So we are sort of looking at rejigging those shelters and looking for alternative accommodations for couples. It's really challenging to come back with a specific cost when the number of couples changes. It's very fluid. Even at Rainbow Park, it's very fluid. Couples come and go, and relationships change on a regular basis. So an actual costing, no, but we are looking to make sure that we're exploring all of our options to be able to support the city in the case of an injunction.
That is critical based on, not a lawyer, but based on all the legal advice, all the court cases we've looked at. That information is critical for that injunction direction. So I appreciate what you're doing, but I do think we need some more general specifics so the county, city can look at. The Warden and I are going to meet after this just to talk in general terms about this. So if we had that information in general terms, high level, we at least understand what we would have to do to try to deal with the Rainbow Park issue. Is that doable for the next meeting?
Ms. Calasani, please.
Warden, to Councillor Bradley, we can provide a high-level overview of what additional accommodations would cost, yes.
Councillor Agar.
So just to be straight, the couples part of this, what do you consider couples? Like somebody that's been a couple for a day, a month, a year? Like there's lots of ways to get around this to say. they're couples, but they've known each other for 3 days and they're a couple. How does that work? I'm just curious. Thanks.
Ms. Calasani, please.
Through you, Ward. That's actually been one of our challenges in coming up with the numbers that we might need and things like that. As you say, it's very fluid. We try to look at individuals who are hoping to move together into housing long-term. So those would be the individuals we would try to accommodate. But again, there's no definite definition out there. So that has been a challenge for us.
Any other questions before I call the vote? All in favor of the motion? Opposed, if any? That's carried. 13B AB is information report regarding Maxwell Park Place affordable housing development. How would you like to deal with this? Councillor Case moves. Councillor Broad seconds. All in favor? That's carried. Thank you. And 13B, Office of the CAO. Information report regarding county budget allocations. Councillor Agar, so moved. Seconded by Councillor Bean. Any discussion? All in favor? That's carried. Item number 14, items not requiring a motion. If I look for a motion to receive and file both sets of minutes, Councillor Broad and Councillor Cook. Seconds, all in favor? That's carried. Item number 15, reports requiring a motion. We have a report regarding small house financial estimate update. How would council like to deal with this? Councillor Bradley.
I'll let someone move it, but I had a question that had come from the private sector on this.
Okay, so, sorry, I couldn't quite hear you,
I'm sorry, I'll let someone else move it, but I have a question related to the private sector comments on this project.
Councillor Ferguson moves. Seconder, Councillor Loosley. Go ahead, please, Councillor Bradley.
I believe Warden Merritt, you received the same email from someone in the private sector that operates a home, just questioning the high cost per bed. When you look at the numbers versus what they believe the private sector could do. So can you respond to that comment?
Mr. Gorgie, please.
Thank you very much for the question through you, Warden Marriott. Your point is well taken. 12 beds is a small project in and of itself, but it does incur the similar fixed costs that a large project would incur. So if you look to, the fixed costs associated with a 12-bed build versus the fixed cost to a 120-bed build, you're going to have a lot of those same costs, but you do not kind of get the economies of scale that you get when you're building multiple units. So it is a challenge to think about what those costs will be as an average across the sector, because as I said, depending on the size of the project, those economies can come in and reduce the per unit cost per bed. So in this case, the size of our home is in our view contributing substantially to the unit cost per bed.
Follow up, Councillor? No? Okay. Any other?
Sure. The private sector part of this, when they're saying that they could provide these services at a much lower cost, was that explored, and do you have any comment on that?
Mr. Gorgie, please.
Sorry, through you again, Warden Marriott. It is a privately, we are looking to do private contracting. We have onboarded a construction manager, we have architects, and we'll be putting this to tender next week and seeking competitive bids through our local trades and construction firms. Ultimately, I don't think it's a private versus partner, private versus public issue. It's really, I think, at the end of the day, the size of the build, which is increasing those costs. So we have costs associated with construction management, having, construction crews on site, fencing, site development costs, demolition. Those are all costs that would be associated with any build. We just don't get the economies of scale because we have to put all those costs in. If it's 20 beds, 100 beds, Now we're at 12 beds, those unit costs are quite high. So it is we will be going to private construction, but because of the size of the project, the unit cost per bed is quite high.
Anything else before I call the question? All in favor? Opposed, if any? That's carried. Item number 16, Committee of the Whole minutes of September the 18th. Motion to receive and file these, please. Councillor Atkinson, seconded by Councillor Miller. All in favor? That's carried. There are no items tabled from previous meetings. Number 18, notice of motion. Look for any notice of motions. Seeing none. Number 19, other business. Any other business before this fine group? Seeing none, moving to 20, notice of bylaws. Ms. Leger, please.
Thank you, Warden Marriott. It is moved by Councillor Miller, seconded by Councillor Veen, that bylaw 24, 25, 26, 27, and 28 of 2024 as circulated be taken as read for the first and second time.
All in favor? Opposed? That's carried.
It is moved by Councillor Miller, seconded by Councillor Veen, that bylaws 24, 25, 26, 27, 28 of 2024 as circulated be taken as read as a third and final time.
All in favor? That's carried. Item 21, adjournment. Look for a motion to adjourn with the next meeting scheduled for Wednesday, November the 6th, with in-camera session to begin at 9 a.m. Moved by Councillor Atkinson, second by Councillor Loosley. All in favor? That's carried. Please join me for O Canada.
O Canada, our home and native land, true patriot love in all of us command. With glowing hearts we see thee rise, the true north, strong and free. From far and wide, O Canada, we stand on guard for thee. God keep our land glorious and free. O Canada, we stand on